Guys, all right to go? Very good. Thanks for joining us today. I'm joined by Dr. Mukesh Haikwal, who's well known to all of you, Deputy Chief Health Officer Ben Cowie, and of course Jerome Weimar as COVID Commander. I'll go through the numbers of the day, and then I've got an announcement to make in relation to some grants to support GPs and community pharmacies to get more jabs into more arms, but I'll come to that in a moment. There are 705 new cases, all locally acquired. That brings us to a total of 8,538 active cases across the state. Sadly, one person has passed away, a man in his 70s from Darebin, and we extend our deepest sympathies and condolences to his family and friends. This will be obviously a very challenging time for them. 81% of yesterday's cases were under the age of 50. Again, we see this day in, day out. This has in every way become a pandemic of the unvaccinated, as we've seen because of priority. Many more people who are older getting access first. Those who are unvaccinated are in the main in the younger age groups. There are some in the older, but there's I think a much larger group of people who are younger because they've only become eligible more recently. That just shows every reason to get vaccinated, every reason to book an appointment and to go and play your part. Not just for the community. You don't need to be motivated by that. I hope you are, but you don't need to be. Just to keep yourself safe. We've got very few people who have had 2 doses of any of the 3 vaccines that find themselves gravely ill, really seriously ill in hospital. That should be a clear message to every single Victorian to book an appointment and go and protect yourself and, of course, your family and everyone else across the community. To give you another further example of that, there are 23% of yesterday's cases are in their 20s. 363 people are currently in hospital. That's an increase of 38 since yesterday. 75 of those are in ICU and 56 of those are on a ventilator. We send our best wishes to each of them and to their families. And of course we take this opportunity to again thank our dedicated teams of highly skilled, highly trained, highly committed nurses and doctors, ambulance paramedics, the whole hospital team working very hard to provide the best care to those 363 people and many more beyond. In terms of tests and vaccines, there were 51,252 test results received overnight. That's a good strong number for a Sunday, particularly a Sunday at the end of a long weekend. There are 29,657 vaccines administered yesterday in state hubs, plus of course there will have been significant activity in primary care GPs, community pharmacies, and that's part of the reason why we've brought Mukesh in today to have a bit of a chat about that work and to make some announcements. That yesterday's performance, so just under 30,000 in state hubs, takes us to a total of more than 267,000 doses delivered in state hubs in the last week. That's a strong effort. And given some of the supply uncertainty throughout the week, which pleasingly has, I think is in a better place now than it was this time last week, we're pleased to have had that many people come through to receive a dose. 78.3% of the 16 and over, so the Victorian population 16 and above, 78.3% have had a first dose, 47.7% have received both a first and a second dose. So we're very close to that 50% mark, very close to that 80% mark as well, which are very important in terms of driving down transmission, protecting more and more people, and getting us closer to our targets of 70% double dose and 80% double dose in Victoria's roadmap to deliver the national plan. As I always do, I'll just remind people that there are 4,000 first dose Pfizer appointments available this week and 7,400 first dose AstraZeneca appointments available this week in state clinics. There will of course be Moderna available in community pharmacies. There will be Pfizer and AstraZeneca available in GP surgeries. So there is significant vaccine out there across all 3 of these vaccines. All 3 are safe, all 3 work. Consult your health professional around those issues about which one is best for you. But the message that's most important today and every day, particularly as we're getting so close to our 70% double and 80% double targets, those key thresholds when we get to end the lockdown and open up, the best vaccine is the one that you can access today. Not to be shopping around for what you might have perhaps convinced yourself or perhaps been told by someone is a better vaccine. The best vaccine, given that they're all highly effective, is the one that you can access today. So please go online and book one of those appointments. Literally thousands of appointments available over the next 7 days for AstraZeneca and for Pfizer in state hubs. Many tens of thousands of appointments available for Moderna and AstraZeneca in community pharmacy. And again, many tens of thousands of appointments available in GP surgeries and in GP clinics across the state for both Pfizer and the AstraZeneca vaccine. All safe, all highly effective to keep you out of hospital, to prevent you from becoming seriously, seriously ill and potentially in intensive care. Now, what we know is that vaccination performance is not uniform. We don't have the same vaccination rates in every local government area across the state. Today we're talking about metropolitan Melbourne. There'll be some further announcements about regional Victoria. But today I'm announcing that in 11 priority local government areas where either we've got, or sometimes it's a combination of high cases and low vaccination, or just vaccination rates that are a little bit lower than we would like them to be, there are some extra things we can do. And you've seen over the journey, we've opened up extra state hubs, we've put extra pop-ups into those places. Today we're announcing something that I think is unique. I don't think any other state or territory is doing this. A partnership with community pharmacy and a partnership with general practice. So there will be 110 grants of $4,000 and a further 10 grants of $10,000 to GPs and to community pharmacies across those 11 local government areas, and I'll read those local government areas out in just a moment. These grants, there'll be an expression of interest process over the next week, and we'll have certainty. We'll allocate those grants on Monday next week. So what it means is, for instance, that a GP surgery can operate additional hours because they can employ some additional staff. I've had a couple of pharmacists put it to me that they haven't got enough room in their shop, but if they had a bit of help, then they could rent some space next door or just down the road, and they'd be able to run, if you like, their own Vax hub in that space. So this is all about additional staff, additional wages, additional space, just common sense. If we can help our GPs, who are doing an amazing job, and help our community pharmacists who've been doing amazing work and are now moving into a really intense phase with these hundreds of thousands of Moderna doses arriving, then we'll get more jabs into more arms. We'll do that more quickly. We'll get to our 70% double dose and our 80% double dose faster than we otherwise would. This is just simple, common sense. And again, I think these will be snapped up really fast. If there's more that we can do beyond it, and of course there will be a regional Victorian the equivalent of this quite soon, but these are the metropolitan Melbourne ones first, and they are in the following local government areas: Moreland, Brimbank, Cardinia, Casey, Darebin, Greater Dandenong, Hobsons Bay, Hume, Melton, Whittlesea and Wyndham. So that'll mean that GPs and community pharmacies can use the full allocation of vaccines that are given to them. They can run extra hours. They can see more patients. They can have more people go through the vaccination program that they're running because we're funding those common sense things that have been barriers. And this is all timed to coincide with that big jump in supply, whether it be Moderna in community pharmacy or additional allocations in our GP clinics as well. So they're two separate parts of the same program, but where we can have some crossover and where we can get the same outcome, which is more people jabbed faster, that's obviously a fantastic outcome. I don't have any other announcements to make today. It may be perhaps best if I pass now to Dr. Mukesh Haikwal, well known to everybody, someone who's been doing, he and his staff out in Altona North, been doing an amazing job vaccinating so many people, really going above and beyond, and he can talk about what he's been doing and also talk about what a grant like this would mean for the sort of care and services that he's running at his practice.